Alrighty. Hey everybody, welcome back to another Fireside chat. Today we are with Dr. Michael Schiff. And as always, I'm David. I'm president of CAPS. Walkie, introduce yourself.
Sorry, I froze a little. Hi, I'm Maxi Diamond. I'm president of CAPS, and I'm so excited to hear from Mikey.
So my name is Mikey Schiff. I am currently a second year oral maxillofacial surgery resident at Mount Sinai. And I went to Columbia for undergrad and then Columbia as well for dental school. I graduated Columbia undergrad in 2015 and I graduated dental school in 2019. So I'm now currently in a 6-year program at Mount Sinai. In year 2 puts me in medical school now. So I'm at New York Medical College. That's the medical school that we are now attending as part of my residency. I'm the last year that's going to New York Medical College. Following me, all of my co-residents will be going to Einstein. But yeah, that's a little bit about me. I've been on the Upper West Side here in this apartment since I started dental school, so 5 years ago. And it's been great. I've been able to stay in the city for residency and made it work. But I'm definitely excited for any mentorship opportunity if anyone ever wants to reach out or anyone is interested in oral surgery specifically, or at Mount Sinai or anything at all. Like, I'm definitely happy to do that. I got a lot of mentorship over the years, or I sought it out, and it was always really, really helpful for me. So I'm happy to give anyone my contact info if they're interested in reaching out.
Great, thank you. So right off the bat, thank you for that. It's very much appreciated. And your willingness to also come speak to us is appreciated. So usually what we kind of like to start off with is what made you kind of want to pursue this career path, especially with OMFS. It's a lot of school. So what kind of inspired you to want to have this career of oral maxillofacial surgery? What got you interested in dentistry or surgery?
Yeah, I guess it's I guess I kind of came to each decision independently. And I guess all the reasons kind of tie into dentistry and oral surgery. So I really early on, I started out Columbia undergrad. Well, in high school, I was always interested in medicine, and then as I started college, I have a couple of family members who are in the dental profession, and they both just wanted me to keep my options open and just are really, really happy with their lifestyle, with their careers, and wanted the same for me. And I think that one of the biggest deterrents of the profession is just the lack of exposure, or like even considering it as an option, or as a medical profession, or as an offshoot of medicine. So for me, I got lucky. I had that exposure, and I shadowed them and I was open to it. And then I kind of stumbled on an oral surgeon who, I guess, everything at that point became clear to me that which was a really nice thing to happen so early on in college. A lot of people don't have that even to where they're at in my age, knowing what they want to do. But I met an oral surgeon who, I put myself in that position though. So I kind of didn't feel like I would have jumped right into the dental profession at that point. And then once I met this oral surgeon, I knew really that this is kind of what I wanted. It just was what I felt to be like the greatest balance of dentistry and medicine. And then obviously within dentistry, just being able to treat patients, care for people, create the lifestyle that you want to create, and work with your hands, have a procedure-based medical career that, I guess, I don't know how much you guys realize yet, but has a really, really way more artistic and skilled type of procedure life than I would have ever anticipated. And it feels really good in dental school to really be perfecting some of the artistry that it comes with, from just the fillings to a full set of veneers to crowns. I mean, the future of dentistry is, moving more and more into just incredible reconstruction of people's smiles and mouths, and doing it, in the most cutting edge ways. And the faculty that I worked with in dental school were all, skilled with 3D printers and, just being able to design virtually these amazing prosthetics. So it was clear to me that that was that was the career I wanted to follow. So that's where here I am.
It's great that you knew so early on,
Yeah.
Exactly what you wanted to do, not only professionally, but, with a sub-specialization, within that profession. Because especially considering I know a lot of people say, oh, wait till you're in school to figure out what you like, and then you can, make your decisions on what residencies to go to. But we've talked to a current Columbia dental student not too long ago, and he knows that he wants to do surgery. So, uh, in speaking to all these people, it seems like there's a common trend almost that, the people who want to do surgery know in their bones, like, this is what I want to do.
It kind of has to be that way, because you're making a decision. You're making a decision to do 4 to 6 years plus fellowship, versus 1 to 0 years. So it's kind of a decision people make earlier, especially with the different requirements that you have to, you have to follow in dental school. So I feel like it comes a lot earlier for those people, but everyone else makes their specialty decisions, at a more natural, like slower progression, and as they get exposed to it. And then it just kind of happens the opposite for people in surgery, where they decided right at the beginning that they wanted to do it, and then a few people decide not to do it, more so than the other way around. That's my experience anecdotally. But it was nice for me to have known earlier on and be able to just focus on what I wanted to do, like what I needed to do to get it done. And it allowed me to persevere whenever things got tough. Because I guess if I knew I wanted to do it and have told myself I wanted to do it for so long, it was just such a strong, fuel for me. Whereas if I didn't feel as confident in wanting to do oral surgery, then, I easily could have given it up, earlier. So yeah, I think I mean, I think there's definitely wisdom in exposing yourself and seeing what other specialties have to offer. But for me, I think, made me more successful to have decided earlier.
So, kind of in part, given you knowing this was the trajectory that you wanted to follow, could you just tell us a little bit about the transitions from undergrad to to dental school, then going into a surgical residency. And like you said, I'm assuming you're in a 6-year residency. So, going from dental school to medical school into the rest of the surgical residency. Could you just tell us a little bit about how that transition is
Yeah, I think
going?
I'm the king of transitions because I don't know of many other specialties that has to transition from undergrad to dental school to residency to medical school back to to general surgery to yeah. So it's every step of the way is a new transition, um, and I guess you kind of get a little bit more used to it and don't get panicked or you know, transitions are hard for everyone. But my undergrad experience was I was a history major. I loved the core. I loved all of the organizations I was involved in, community impact, Hillel, um, CAPS, just a lot of different organizations. And obviously I enjoyed the college life. I just felt like um, it was the 4 years where I probably was able to do and see the most, and you just kinda have to accept that moving forward, um, it's more about just setting in motion what you plan to do for the rest of your life, and that was a big realization as I started dental school that this is a skill that I am now trying to learn and train myself in um that I plan to use the rest of my life as opposed to just a love of knowledge and learning. Um, and so I guess it's a maturing experience and as fun as I at least my class dental school, the classes themselves are a nice size where there's plenty going on. There are plenty of things to get involved with and plenty of you know, social opportunities, but there's definitely a more um, career-oriented, future or goal-oriented undertone to the whole thing. Um, and it's good because while you're training, you definitely have um, you still have free time and you still feel like it's school, which a lot of people like. A lot of people like the structure that school provides, and it's definitely structured like that. And then transitioning to residency for me was work. Like I don't even know where to begin with um, my intern year. So the way it works for me is I do an intern year of oral surgery, and then I go back to medical school. Whereas a lot of programs will start off in medical school, and then you do 4 residency years. So for me, they do 1 full year of intern year of residency, and I mean you're going from 1 week doing fillings and root canals to week 1, of your residency. You're really I mean, you're a doctor that's responsible for patients and is looked to by ED emergency room attendings that have been doing it for 50 years. And you're the specialist, you're the consultant, you're the one coming down to the emergency room to, stitch up major facial lacerations, drain infections, um, do head and neck exams, examine facial trauma, and be responsible. And it's a real responsibility being on call. It's a real life responsibility, and I've been involved in with patients that needed my care emergently, where their airways were closing up due to infection, and so that's a major transition. But even within dental school, transitioning from a second year to a third year and treating patients is a major transition. Um, and but it's the most satisfying thing I can imagine. I'm so passionate about it. I can't see myself doing anything else. And it um, I'm excited to talk to you guys because you guys are going down the same road, and it's an exciting thing to be able to treat patients and, I mean, make of the dental career what you want it to be. So the transitions were all difficult, but I guess when you're, this is what actually a pediatric GI told me today. She literally said today, if, there's no, because I was talking about how many years my, track is. And she's like, there really is no, I mean, if you're doing what you love doing, there's no such thing as like too long of a path. It's because for me, it's, medical school right now, I'm not always doing what I like doing, but in residency, every case is really interesting. And, it's really it just feels great to be the one that's responsible for treating these people.
So that's definitely, like you said, king of transitions. That's
Yeah.
especially considering you studied history undergrad. I'm a history major, so it's looking forward down the path. It's definitely an added kind of point of transition. Now, you kind of touched on this just before, but could you tell us about some of the challenges that go along with, um, maybe just your day to day as a resident, or looking back when you were in school?
Yeah.
What kind of challenges you would face?
Yeah. I mean, like there are a lot. Every day is a challenge, honestly. But in different ways. I guess in just starting out in dental school, for me in Columbia, we had the same schedule as med students for the most part. And you just have to swallow the fact that on top of that, we have a really, really thorough, dense preclinical curriculum, where you're studying for med school exams and trying to train your hands. And where do I even start with like how new of a concept that is? I mean, the movements of some people, it clicks. With me, it didn't click. Working with your hands with a drill, at such a high RPM, it's something like in such a small, tiny space. I remember them giving us like a block one of the first weeks, and I was like, no, this is a joke. We shouldn't be able to do this yet, right? And there are some people that were just doing it like as if they have been doing this for a couple of years, and there are other people that were just all over the place. But yeah, I mean, by the end, I guess, I don't know when it happened. I can't say like when it clicked, but I just kind of noticed that I guess it kind of works for me now. It's a muscle memory thing, but it's the most frustrating thing where you have med school exams, and then the thing where you look at, and this is what I will be doing for the rest of my life. You realize how challenging it is to learn that skill. And it's an underrated and underappreciated thing, but the technique, like the technique sensitivity of using a drill in such a small little space is not something in my med school experience, any other medical professional is doing on such a regular basis. So it really requires a lot of dexterity, a lot of skill, and and that comes with training. So I guess like in my undergrad studies and in school and high school, everything can be studied for, and you kind of start feeling like that what you're studying, but it's really frustrating to just try and fail so many times, and being used to getting good grades and then handing in typodont, like teeth that you just know are not like up to snuff, and you're usually a better student, you're usually someone who does better. And it's just that your hands aren't there yet. And it's not something that you can just pick up in a day. And, but that was definitely a challenging, those were challenging nights. Like a lot of people would just, before these practicals, would spend a lot of nights in the pre-clinic, just doing tooth after tooth after tooth. And those, I just, definitely remember those. Those were certainly frustrating and challenging. But then you would just take pictures of the ones that came out good, and you're like, wow, like I'm come a long way. And then, I mean, I don't know that residency is exactly what everyone, like what the audience here is most interested in. But the challenges of residency are mainly psychological. You're now someone who's treating patients, and I guess they're not looking at you as a student anymore, even though for my specialty, everything I'm doing is the same thing as a third year dental, like a second or third year dental student doing these things for the first time. So I definitely view myself as a student, but the patient, the hospital, the emergency room, all the services that consult you are looking at you as an expert, whereas you are looking at yourself as a student. And there's just a shift in how, when they call you doctor, there's a shift in just, I guess, how much pressure that comes with. And then just the way attendings will expect certain things, and will give you tough love. That's kind of an old school but very commonplace approach. If you're stitching up after a case as like a first year, they'll comment on every single stitch, every single hand movement, every single, like how you hold it with your fingers, everything. And you could just go home at night totally beat up, as if you are worthless and were stomped on. And the only skill that I really feel like I gained in my first year is just like brushing stuff like that off. And I think you're gonna have to do a lot of that in your career, just brushing off tough days and times where you're just feeling like it's not clicking, because residency is every day. That's what it is. But then at the end of the year, and you have all these, for me, pictures in my phone of like all of the facial lacerations that I stitched up, ears, noses, eyes, all of it. You're like, I don't remember one time feeling good about any of this stuff, but now I feel really accomplished for having done it that year. So, I don't even know if I remember the question, but
No, that answered everything perfectly. It was we asked challenges, so that really
yeah.
illustrated that. One question, kind of going off of something you mentioned just before, how with medical school. So your residency, you're doing your, like you said, your I guess it would be called a PGY1, and then a year of med school, if I understand correctly.
Yeah, so I did a PGY1, and then I am a third, and then my second year of residency is, for me, the third year of medical school. I joined the third year medical school class, and then I do years 3 and 4 of medical school. And then I rejoin. I don't even rejoin the service yet. I do. We are now required to do 6 months of anesthesia, and then I do a full 12 months, a full year of general surgery. And then I do years 5 and 6 are back on service as a senior and then a chief. So, I did my intern year last year, PGY1, just oral surgery internship. And I guess quickly, some of the responsibilities, I mean, I basically had all the responsibilities, because the chief, I mean, I guess it's still like an old fashioned thing, but you know, the intern is like, it's like a hazing type of thing where it's like anything that actually has to be done to work to pre-op a case, to, you know, work up a case to get them ready for the operating room, whether it be financial clearance, medical clearance, clearance from anesthesia, scheduling for the OR, like being the one who takes call and has to go in person, um, and just administrative responsibilities, um, just keeping logs of all the cases that the chief did. Um, so just a lot of that, and but really good dental alveolar experience most people get in their first year, and good facial trauma experience, and just exposure to the operating room. We did a whole array of cases. We did hip grafts to the jaw. We did orthognathic surgery. We did a lot of TMJ surgery, a lot of trauma. We did cleft, you know, some cleft surgeries, some interesting cosmetic surgery. Like we did some rhinoplasty. Um, so I've, you know, just being exposed to a lot of different cases and seeing what you're interested in. It's it's been a good experience for me. And then now I'm in medical school, and as a third year med student, you do rotations. So I'm on clinical rotations. So psych, neurology, family medicine, internal medicine, surgery, pediatrics, OBGYN. So just you know, exposure to the entire medical world.
So one of the things, going off of what you just said, especially with joining as a third and then fourth year med student, what's that like? Just being with the med students as somebody who has gone through dental school and a year of residency. Is there like, you know, kind of, do they look up to you, the other students, or is there, you know, a separation at all?
It's a really good question. This is what's, I guess, most occupies my mind now, for the last year. Um, I think it's been a really interesting experience, seeing what other medical colleagues, whether it be attendings, to medical students, to residents, just seeing what their level of exposure and knowledge is to what I am doing and what I choose, what I'm, you know, the path I chose. Some people are fully aware of it, and some people are not. And so it kind of comes with a lot of responsibility, um, to, and I guess they don't think about this, but we all kind of do and talk about it, to like represent ourselves in a certain way. So just because it's the medical students that know about what we're doing all kind of say, oh yeah, you know, I've met someone else, an oral maxillofacial surgery resident who is, you know, doing the same thing, and he knew everything. He was so knowledgeable and helpful. You know, because I did a year of an intern year, so I have some skills that, like on a surgery rotation where medical students barely know how to, you know, suture, we are able to, you know, impart a little bit of, like, help out a little bit. Obviously, there are things where we know less. It's less at the forefront of our minds how to do an abdominal exam than it is for medical students who have spent the first 2 years really just thinking about that. But then there are certain things where we are just used to being in the hospital. These third year medical students have not stepped foot in the hospital a single time. So just being comfortable in the hospital, is just a nice reassuring thing to other med students. Um, but yeah, I kind of feel a little heightened responsibility as a, you know, just um, as a profession that kind of has one foot in two worlds, to be able to, um, I guess, make sure that we are appreciated, and just, I guess, to just to make sure that people are aware of our services and the scope of our practice and our training and how intense it's been and how much we're able to provide. So yeah, I guess everyone that I've spoken to finds it to be a different experience, in terms of what med school they're at and who their med students are that they speak to. You come across an ENT who knows every oral surgeon out there and knows exactly what you're doing and can talk to you like you're their student. And then you can talk to an OBGYN who has no idea what I can explain it 10 different times, 10 different ways, and they would still not really get it. So yeah, I guess your passion for it kind of comes through when you're explaining what you're doing. They kind of feel how strongly, you feel about this profession.
So needless to say, it's a unique medical school experience.
Absolutely.
One thing that that kind of brings up in my mind is you're doing all of these things almost at once, but at least one after the other in very short succession. So how do you balance everything? Because I know obviously you're in dental school, so you're studying and all of that. Then you're going to a residency year, so you're running around with that. But I'm assuming you still have to do some studying for various things, and then you're back in med school with more. So how do you balance, I guess, the student life, the personal life, the work life?
It's a tough question. I guess it came pretty easy. I am I guess I'm a more chill personality than some people who can just not have a social life and all they focus on is their career. So I've managed to, I guess, find a balance somehow definitely throughout dental school and definitely in medical school. I have only 1 year of real residency training where finding a balance was not as easy. And it's not easy for many people in their first year where you're taking call every third night and you have to sleep in the hospital. So balance is not something that some of the stages of residency really allows. But beyond intern year, as a chief resident, my chiefs had, families, they had kids, and they're not going into the hospital. At a certain point, it really comes down to the ability for the intern to take on the responsibility to manage call and go into the hospital. And the chief is just available over the phone, but it's more of a reasonable life, hours wise. But in dental school and medical school, I guess for me now in medical school, the way I balance it is that I really love reading surgery. Like I love reading about what I want to do. Like head and neck cancer. I just like, to me it's enjoyable. So it makes balancing easier where like I want to pick that up when I'm not engaging in some random social activity or something. But yeah, medical school and dental school definitely allow for you to find hobbies and become a part of some organization. My dental school was 80 students, and I think everyone was involved in something. So it's definitely very doable. I don't have any tricks on how, but it's doable.
So there were 80 students in that class. How many students or residents are typically in an OMFS residency program?
Yeah, so for it's every residency program is different, but I know that it ranges from about, I think Montefiore has like the most, they take 5 residents a year. My program just merged, so it was 2 in each program. So we take 4 residents a year. I know there's a program out there that takes 1, which is certainly seems like a lonely experience. But so yeah, so it's 4 a year, and then there are 6 years. So it's about 20 or so. It's 20 or so residents in a program. So it's fairly small. There are other medical specialties that are also as small, like 4 to 5 residents a year. But it's, I guess it for me, some of my closest friends right now are in my, because you spend a lot of time with these people, and you get like when late at night or over the weekends when one is really upset or really stressed, or you get you're thrust into relationships with these people, just because of how intense the experience can be. But my co intern last year, I was really close with. I'm still really close with him, and I had a senior who you like looked at me as like her son, basically. Like I was her intern, and she just taught me everything she knew and gave me a lot of advice, and it was great. It really, when you're in these programs, at least for me in oral surgery programs, it feels there's certainly a family element to it. A lot of people are off in medical school or on general surgery, and then they come back and you welcome them back. But the people on service at any time, they kind of know what each other is doing because there's so few of us. And everyone kind of took a similar tough path and had similar interests. And so it's easy to bond with these people. And to this, like my chiefs, I'm still in touch with. Like one is in Knoxville, Tennessee, practicing, and one is practicing in New Jersey. So yeah, it's good to maintain these relationships, and it's pretty easy to when you're going through residency with them.
That's awesome. And I didn't realize it was that small. It's that's crazy. You know,
Yeah, 200.
one other,
There are
sorry.
220. I believe there are 220 spots. It's a very small field. In the country, every year there are 220 residency spots, to my knowledge. So there are not that many of us, and it makes a lot of sense why people are not very familiar with what we do, and just the route that we took.
One thing I wanted to ask before we kind of get to the closing questions is, right now we're doing this over Zoom because there's a pandemic. So what we've been asking uh, everybody that we talk with is how has it impacted practicing, um, especially in your case where you, if I understand correctly, were probably going from being a first year resident into being in school again. How did that kind of all get impacted by COVID?
Yeah, it was definitely a whirlwind that was definitely not what any of us signed up for. But when you're a resident and it's happening, you're kind of called upon to do things and figure things out. So my program, a lot of oral residency programs in general cover a lot of different hospitals. So my program, Mount Sinai, and all Mount Sinai medical residency programs send residents. We cover Elmhurst Hospital. So Elmhurst was the hospital that was hit hardest for most of the pandemic, for the big whole first half of the pandemic. Videos out of, in my emergency room that I was at all year long. And it was just surreal how much it just turned into this icon of like how we were behind the 8 ball on everything. But we cover Elmhurst Hospital. And so it just turned into an entire hospital for COVID patients. So they shuttled a lot of our residents um, over to Elmhurst, and covered, we covered an ICU in one of the operating rooms. They just put a couple of beds, and we covered an ICU with the orthopedic service. So it was us and ortho managing an ICU, and the ICU next to us was ENT, and like every resident was just called on to, just manage these ICUs. And it was nice to see that our chief residents, with medical training, with anesthesia training, with general surgery training, were highly equipped to effectively run critical care. And it definitely reaffirmed how nice it is to be going into this field where we get such a broad training. For me and my co-intern, we obviously had a harder time picking up what was expected of us. So they didn't really have us covering that much, but we were in emergency rooms. Still, facial trauma was still happening. So we were stitching up faces and being in people's mouths when this was all going on. It was weird. It was like very eerie for a while because people were not coming in for, into our like oral surgery outpatient clinic. Like no one was coming in. And we were only treating people with, major infections that were emergent or urgent. But then as we started reopening, all of the infections that people let sit, it like kind of blew up in everyone's faces. And we just had a steady stream of just major deep space infections that all needed to go to the operating room to be drained. And it was very interesting. It was frustrating a little bit for my training to not be able to go to the operating room for any elective cases. A lot of the orthognathic cases that took months to really work up surgically were put on hold. A lot of trauma cases that would have ordinarily gone to the operating room, we did, went kind of the old fashioned way. We wired people shut, their jaws shut, and tried, to use methods that predated some of our modern fixation techniques. But it was I was happy to have been be still in residency while it was happening and feel like I was contributing. It makes me feel good about my role throughout the pandemic. Certainly isolating. Obviously, my roommates all kind of took off and left me here as a little bit of scared of what I was bringing back home. So, and then med school has been, it's kind of, hospitals are all fairly back to normal in terms of what services they provide. So for once I started med school, pretty much all rotations were back to normal. But I was happy to have caught a little bit of my residency training, being able to contribute to the efforts.
Wow, that's intense.
Yeah.
Yeah, that's crazy. But it sounds like it was a great learning opportunity at the same time.
Absolutely.
One, question that we kind of like to start to finish things off with is if you have any advice or wisdom that you would want to pass on to current undergraduates. And then part two of that is there any advice or wisdom that you wish you could go back in time and give yourself when you were an undergrad?
Well, I guess I touched on, I'm pretty long-winded, so I guess I touched on a lot of it already, but I definitely feel like it was a really humbling experience. Nothing about getting to where I am. Obviously, I still have a ways to go, and it's a huge uphill battle. But nothing about like getting into this residency program came easy. And it might seem to to everyone individually that this person has it easy, or that person it's coming naturally to. But from the first time I touched a drill to taking what's called the CBSE exam, which is basically step one that you have to take to get into oral surgery program. It was an absolute test of my perseverance. So I, like most people, take it once, some take it twice, but I took that CBSE exam 3 times because I definitely felt like I needed to do as well as I had to. So I just think if you tell yourself you want to do something, don't really allow for anything to get in your way of it. Like if something gets in your way, I mean, you just can pick yourself up and try again. And it's cliche, but I absolutely picked myself up 3 different times to study for months and months for a really intense exam that is 6 hours or 8 hours. It's the test that people, after their first time, people don't go into oral surgery because they don't even want to bother to study or take that test. And people who don't do well the first time like grapple with taking it a second time for months. And I took it an astronaut, like I took it 3 times, which is kind of unheard of. And I just knew it didn't matter. Like I knew this is what I wanted to do, and I was just going to keep doing it until I got what I wanted, until I, did what I wanted to do. And it just makes the journey feel a lot better to have struggled and pushed myself and, seen elements of my character, that I didn't know was there. And it just, I think it's the most important thing to consider, to keep in mind when you're going through it, that it's not going to always come easy. But if you know you want to do it, then it doesn't even matter how easy it is, because if you keep trying, it'll eventually get easier. But I guess for undergraduate students, it definitely wouldn't be the focus. Like I love that I wasn't focused on any of this stuff then. Like I had the best time undergrad. I focused on like my favorite thing to do every semester was picking my history courses. Like pre-med was nowhere near my most memorable, like like my memories of college were not pre-med. Like I loved everything else about college. So I guess right now, just try and enjoy college while it lasts, because it gets real pretty quickly. And then what was part 2 there?
That was actually both parts. So
Okay, there you go.
yeah. Well, I think you answered both parts in it, which was, advice for yourself and advice for undergrad. So I think that kind of encompassed both a little bit. I gotta say, this was really awesome.
Yeah,
In part, I'm I'm a sucker for stories of perseverance and kind of, almost Rocky level, sticking to it. So this was, not only enlightening, but it was just, great overall. So I really appreciate you speaking with us.
of course. Yeah, I'm happy to help. And if anyone wants to reach out, if you want to give anyone my contact info, if they're specifically thinking about oral surgery and the route and what is required, like just requirements and whatnot, more than happy to speak to anyone. So I appreciate you having me on, and I hope that this helps someone out there.
So interesting and so helpful. Thank you so much.
Yeah, of course. My pleasure.
Alrighty. Have a great night. Thank you.
You too. Take care.